What factors affect your fertility as a black woman? This video examines specific causes of female infertility in black couples or black women, or problems that lead to female infertility which tend to happen more often in black women. Also, what should you be doing 10 or 20 years before you hit your 30s and 40s and start worrying about the challenges of getting pregnant? Hi everyone, welcome back to my channel. I'm Dr. Sylvia, a general practitioner and the founder of AskAwayHealth, and we're all about your health, your family's health, sexual and reproductive issues, everything we can talk about to help you live better. Now, what is infertility? Well, loosely defined medically, it's when a couple have been trying to get pregnant for 12 months at least, and they've been having regular, unprotected sexual intercourse at least 3 times a week. However, this is not a fixed definition. If you have conditions that might affect your fertility, for example, fibroids or endometriosis, or you're older than 35 years, you shouldn't be waiting 12 months to seek help or advice from your doctor. Of course, we also have male factors that affect fertility, but today we're talking about women and we'll be addressing men's factors in another video. Now, do you know, I heard somewhere black women apparently are extremely fertile. So why are there so many black women with challenges of infertility or difficulty getting pregnant? Some studies actually suggest that black women have twice the challenge of falling pregnant compared to white ladies. That is interesting, and I think is worth a lot more studies, but here are some reasons that we are aware of that can make getting pregnant even more difficult for black ladies. They're in different categories, but let's start with the first one, which I call the social, environmental, and economic factors. 1. Black women may not go to see the doctor early enough to discuss a fertility problem, and there are different reasons why this might happen. First, seeing a doctor early affects the chances of successful treatment, and there are different reasons why a black woman may not see her practitioner early enough to address this problem. First, there is the impact of religion or belief in God affecting a person's health-seeking behavior. In other words, some people have this problem and believe it's something that can be addressed by their faith or their hope in God, and so choose not to come and see the doctor early. This is important because a person might believe that their faith will provide a solution to a particular problem, and so they choose not to take alternative sources of help for a long period, and that delay might affect their later treatment when they choose to come and see a doctor. Next, black women may be unaware of the implication of some symptoms that they have. This has to do with education or awareness about what certain symptoms might mean. For example, very heavy periods or prolonged bleeding. These are not normal circumstances, but because a woman is not aware, she might think, well, it happened to my grandmom and it happened to my mom, and if they lived with it, it must be normal. And this is the case for many women who do not realize that these symptoms could indicate problems like fibroids or endometriosis, which can be treated and which could affect their chances of getting pregnant. So let's not forget, any fertility treatment is more likely to be successful when it started earlier compared to waiting longer to begin treatment. Next, the stigma of being thought infertile by the rest of your local community. So feeling ashamed of something that is not really her fault can delay some women in seeking help early. In certain cultures where black women live, they feel isolated, they are scared to discuss this problem with friends or family because they assume, well, black women are supposed to be fertile, so something must be wrong with me. And the next problem is a lack of financial independence, when many black women may rely on their husbands or their partners for their upkeep. And so even if they do think they have a problem, even if they do want to seek help, they do not have the sources, the funds to be able to see a doctor and get tested and investigated for fertility problems. Another factor is being constantly subjected to different forms of stress. These may arise from worries that are work-related or family-related, racism, cultural challenges that are specific to women in different parts of the world. They can lead to chronic inflammation and often show up in other medical conditions that are associated with black women, for example, high blood pressure, diabetes, and so on. Another challenge, and I referred to this earlier if you caught it at the beginning, is that medical practitioners believe that African women are naturally more fertile. In other words, they think we're less likely to have fertility problems, and that when we come to talk about these things, we are exaggerating our symptoms. So instead of quickly encouraging treatment or tests to work out what's going on, they encourage women to keep trying or just to try longer when they should be doing tests to get the job done. So that's a look at some of these social, environmental, economic factors that may affect Black women more and may lead to infertility in Black women. Now let's look at medical factors, and they're common to women whatever the race or ethnicity, but you could also find some that are a little bit more frequent in Black women. There are problems with hormone balance that lead to ovarian failure and polycystic ovary syndrome. And if you don't know about polycystic ovary syndrome, check out this video here where I do talk a little bit more about this condition and explain what it is. But in terms of a structural problem whose impact is felt more in Black women, the first one is fibroids. Yes, fibroids are very common in all women, but they seem to have a significantly higher incidence in Black ladies. Fibroids are benign tumors of the womb, and the presence of a fibroid disrupts the womb, making it difficult to get pregnant or to stay pregnant. So it increases the risk of miscarriage. In addition to that, studies suggest that Black women tend to have multiple fibroids, develop them at a younger age, and we have more severe symptoms, making it more likely that we will need to have invasive treatments that can affect fertility, for example, myomectomy or even hysterectomy, given the degree of symptoms. Next, we have tubal factors or disease, and this refers to any condition that affects the fallopian tube, tubal diseases. Studies again indicate that Black women, we are more likely to have tubal diseases, for example, from sexually transmitted infections. And when it comes to tubes that have been damaged as a result of this, the fertility treatments available are likely to be IVF, which are very expensive and may be out of the reach of many Black women, depending on which part of the world that they are. There are lots of other conditions that can affect the womb. Another one is endometriosis, and I also talk a lot about endometriosis and fibroid. Please go and have a look at videos here. I also place the links to all these resources in the description box for you. Next, let's look at lifestyle, including weight and diet. Excess weight means increased estrogen and also means a reduced chance of ovulation. It can also affect the chances of having a safe pregnancy and the development of conditions like diabetes mellitus. Poor exercise habits or culture can make you feel more tired, less in the mood for sex, so that affects your libido because you have less of the happy hormone endorphins, which are produced when you exercise regularly. And this can also affect a woman's chance of getting pregnant. What about sexual relationship? Well, this is not unique to Black women, but some women may get married later on in life where getting pregnant is a bit more difficult, or they may have had relationships in the past where they either had multiple abortions or terminations, leading to scarring of their tissues, the womb or the tubes, or they have sexually transmitted infections, which can also affect fertility. With that said, what are the chances of getting pregnant with fertility treatments? According to specialists, if you're under 30 years, you're more likely to have a 50% success at getting pregnant. Around 40 years, that drops to a 10% success rate. While between the ages of 40 and 50 years, there is a 5% chance of success, even with IVF treatment. So this is just to emphasize again why early treatment or paying attention to fertility problems earlier is better than waiting to do so. And let's not forget that the risk of miscarriage increases as we grow older, up to around 90% around the age of 40. Many times we don't know the reason for miscarriage, but it may be that this is because the eggs are older, they carry older chromosomes or genetic material, the same chromosomes that they've had since birth, because don't forget, all your eggs have been with you since you were born. Now, what are the tips we can use as Black women in our early 20s to avoid fertility problems in future? First, keep your fertility at the back of your mind from a very early age, even when you're not ready to get pregnant. Being conscious of your egg reserve and that it is reducing over time and the timing of your most fertile years can help you make decisions, especially for career women. There's some blood tests that your doctor can do, for example, the anti-Mullerian hormone AMH, which can give you a snapshot of your ovarian activity, although it's not a predictor of future pregnancy. Number 2, keep a healthy weight, incorporate a healthy diet and regular exercise. Avoid processed food where possible and go for a plant-based rather than animal-based diet. Number 3, no smoking. This can age the ovaries, and avoid alcohol, keep it to a minimum if possible. 4, be menstrual aware. This means you should monitor your menstrual flow every month. Please don't accept the traditionally held beliefs that there is nothing you can do about heavy, painful, prolonged periods. They are not normal. There might be some underlying condition that's causing them, which can be treated. And even if there is no obvious cause, we can do something to reduce the impact and the distress it can cause you as a woman. Number 5, practice safe sex to reduce the chance of sexually transmitted infections. These can lead to PID, pelvic inflammatory disease, which not only is a potentially life-threatening condition, but can affect your tubes and womb, causing fertility problems in future if it's not properly treated. Number 6, birth control options. This might sound a little strange, but avoid tying your tubes too soon, especially if you're in your 30s and you think you've completed your family. If circumstances change and you want to have more children, it is difficult to reverse sterilization. The tubes are damaged and you will need IVF. Instead, there are long-term birth control options like the implant or the coil that can be easily reversed when necessary. So, thank you for watching. These are some of the issues relating to fertility challenges among Black women. Let me know if you found this video helpful, any thoughts or anything else. And to learn more about fibroids, check out this playlist where I've got so many different videos that tell you how they happen and available treatment options and more. Don't forget to like the video and subscribe to my channel, and I'll see you in the comments.